teacher, we're also proposing an additional rank. Kasi ngayon, it's only up to master teacher. For right now, a master teacher gets my salary as a full professor in UP. And we are proposing the addition of another rank of master.
Rich food, sa dahon, sa gulay, ito yung mga medyo malalagkit ang dahon, no?
Yung mga adudan ng mga 5 years given attention and recognize the services of our teachers. Lastly, Mr. President, we are initiating a number of new projects. I always say, Mr. President, that I am the oldest in the Department of Education, but I am the youngest in terms of ideas and programs in the department. And we have established what I describe as the Education Futures Program, wherein we try to discern, hindi naman parang Madam Auring, what society will be, what it will need, so that education can respond. Like, for example, the possibilities now of robot teachers which are being studied in other countries, brain implants, machines which are so much better than humans, and how can humans remain human in the light of all these fascinating developments. So we are not looking at next year's election, Mr. President, but perhaps 30 years from now, 40 years from now, what would society be like? How will we prepare our learners? How will we prepare them mentally, aside from memorizing multiplication tables, Mr. President, as well as correcting the grammar? So this is one program which we are very interested in. And of course, another new addition of the Senator Law is still with me, of course, the establishment of the National Academy of Sports, which we are hoping to open also within this year, also together with the formal opening of classes. So bago itong dalawa, National Academy of Sports and the Education Futures Program. So, Mr. President, these are just a few of the things that we have achieved with your support, with your inspiration, and of course, with your financial generosity. And we look forward to attaining these goals by the time your term ends. Thank you, Mr. President.
Salamat, ma'am. I'd like to call on Professor De Vera and something to add to the especially the chair.
Thank you, Mr. President. I have a PowerPoint presentation. I see that makes it. Can you please flash it? Okay, I'd just like to give an update, Mr. President, on the reopening of classes in higher education. Next slide, please. Out of the close to 2,000 universities and colleges, about 1/3 has already opened in August, Mr. President. So nagsimula na yung semestre para sa ibang malalaking eskwelahan. The others are opening this September and until October. So we have successfully opened the school year 2021-2022 all over the country. Next slide, please. Dahil sa pagpirma nyo ng free higher ed, 1.6 million students are now not paying tuition and miscellaneous fees anymore. So, libre na ang tuition and miscellaneous fees ng 1.6 million mga estudyante sa nagpas 200 public universities all over the country. The enrollment has increased from academic year 2019-2020 to 2020-2021. So malinaw po, Mr. President, ang mensahe na pwede ka na hindi lamang mangarap kundi makamit ang iyong pangarap sa kolehiyo at university. We also are funding about 435,000 students in public and private universities through the tertiary education subsidy. Yung mga nag-aaral sa public ay nakakakuha ng funds, Mr. President. Naging lifeline ito sa panahon ng COVID. Kasi ang enrollment sa public universities has not declined during COVID. They libre ang tuition, at yung 40,000 na nakukuha nila ay naging ayuda na pangbuhay ng kanilang pamilya ngayong panahon ng COVID. So, kung hindi po napirmahan ng RA 1091, Mr. President, mas grabe ang magiging epekto sa panahon ng COVID. Madami hindi makakapag-aral dahil walang pang-tuition at walang pang-tustos. Kasama pa dito ang 210,000 na tulong-tulong beneficiaries. Next slide, please. Maliban sa RA 1091, we are also subsidizing now about 91,000 additional students in public and private universities through merit scholarships. Ito yung mga scholarship para sa makapiti ng mga estudyante. At dahil sa bayanihan ko, binigyan ang check ng 300 million pesos para bawasan ng tigil 5,000 yung utang ng mga estudyante sa private schools para mabawasan yung kanilang utang. At natulungan natin ng 60,000 ng mga estudyante for this year, 2020. Next slide, please. Meron mo kami kinakanggap na dalawang lawa. Ito po yung diniscuss ko na kay PS Medellea. Yung una ay yung CHEP PNP DILG Scholarship. Nakausap ko rin po si Secretary at Anya tungkol dito. Meron na kaming MOA na ready na pirmahan para bigyan ng stipend ng mga anak ng mga AFP at PNP personnel for student action against insurgents. Nakatungkol po.
Good growth and good deeds. Alright, wala kay Rick.
Ganito dati. So, sabi mo, will be for discussion and signing. Paano matulungan natin ang anak ng mga student action against insurgents. Kasama po ito dun sa utos nyo sa Federal Cabinet meeting sa loob dun sa ating anti-insurgency program. Yung isa pa po, na hinahanda namin, may MOA na rin. Next slide, please. Yung balik loob scholarship, ito po ay sa Armed Forces, para dun sa mga anak naman ng mga rebel returnees. Ito po ay bahagi ng utos ni A.S. Bingbong in one of the cabinet meetings to work on this program. Ito po ay kung paano at kailan ito pwedeng simulan. So pinapalawak po natin yung mga matutulong ang mga bata para sila makapagpatuloy mag-aaral. Next slide, please. Nireport na po ni Secretary Bebot Bello ito, yung tabang OFW. Binigyan natin ng 30,000 pesos ang anak ng mga OFW na bumalik sa Pilipinas at hindi makaalis. Ang natulungan natin sa ngayon ay 16,719 dependents na. Meron pa po tayong natitirang mga 500 million para dito para pwede natin i-cover itong current school year. So in total, ang matutulungan natin ay pinaka-kundi yung 16, kung sila ulit bibigyan pa ng isang taon, matutulungan natin ito. So binibigyan natin sila ng 30,000 pesos na grant. At baka sakali naman, kung bumuti yung ekonomiya at sila makaalis na, baka hindi na nila kailangan nito sa susunod na taon. So meron po tayong 1 billion na allocation dyan. Sabi niyo po, dun sa isang programa ay Natagdagan nyo ng 3 bilyon itong programang ito. Ito po yung report ni Sec. Bebot. Galing po ang pondo sa CHED, pero ang implementasyon ay pinagtutulungan namin ang DOLE. Next slide, please. Nagpapasalamat kami, Mr. President, na noong January, pinayagan nyo na yung limited face-to-face classes sa Medicine and Allied Health Sciences. I would like to report that we have inspected and authorized, kasama ko po si Sec. Charlie doon sa unang inspection noon, we have inspected and authorized 118 schools to hold limited face-to-face classes, covering about 247 programs. Next slide, please. Ito yung covered sa ngayon: medicine, nursing, physical therapy, midwifery, medtech, speech language, dentistry, hanggang radiologic technology. Ito yung mga programang nag-face-to-face na yung mga selected schools, mga 3rd year and 4th year students ito, dahil kailangan nila yung hands-on experience para sila ay maging bihasa sa kanilang ginagawa. Next slide, please. So, there are now a total of 13,000 students who are authorized to hold limited face-to-face classes in MGCQ areas, and GCQ areas where there are COVID-19 hospitals, and more than 1,000 faculty members who are authorized to hold face-to-face classes. Next slide, please. Last April 15, papasalamat po kami sa IAPF at inakyat yung category ng mga estudyante at faculty na maging essential health workers sila. So napapakunahan na natin ang close to 10,000 students doing face-to-face and more than 1,000 faculty members doing face-to-face classes. So we have put an additional safety level doon sa mag-face-to-face. Kaya po ang resulta, next slide please. Ang resulta, Mr. President, from January until last month, ang infection level sa mga estudyante ng face-to-face is less than 1%. It's only 0.3%. Sa faculty, 1.4% ang infection level. Lahat ito ay mild at asymptomatic. Wala pong na-hospital at walang namatay na bata o faculty sa limited face-to-face classes. Next slide, please. Kaya ang aming hiling, Mr. President, ay baka pwedeng i-expand na natin ito sa ibang programa na kailangan din talaga ng limited face-to-face. Dinala ko na po sa IAPF at inindoso na nila sa inyo ang pag-expand sa 3 main areas: engineering, HRM, at maritime programs. Ito lang po muna uunahin natin kasi dito kailangan talaga ng skills, lalo na sa engineering. Sa maritime program naman po, sumulat na yung mga international maritime companies sa Philippine schools na kung hindi papayagan yung mga estudyanteng sumakay ng barko, mag-shipboard, ibibigay po nila yung slot sa ibang bansa. So meron pong urgency na payagan natin sila kasi kung hindi po maka-shipboard, hindi maka-train sa barko yung ating mga estudyante, sila po hindi makakakuha ng hindi makakagraduate at hindi po makakasakay sa mga barko sa labas. So ito po ay pumayag, in-endorse na po ng IETF 3 weeks ago at pinadala ko na po ang sulat sa inyo. Ligtas naman po, maigpit ang ating guidelines. 24 pages na guidelines na ginawa ng CHED at DOH. Wala pa pong namamatay, wala pang na-hospital. Isisiguruhin ko namin na kung papayagan nyo itong mga ito, ganun din po kababa yung infection level. Finally, Mr. President, sa pagtutulungan namin ni Secretary Vince at instruction ni ES Medialdea, tapos na po yung guidelines ng Chair at saka Department of Health para payagan yung mga estudyante sa 4th year and 5th year medicine and nursing at yung mga graduate na hindi pa nakakatapos ng licensure exam, napapayagan silang maging vaccinator para po dumami yung ating mga magpapakuna. Tapos na po yung guidelines, isusumitin namin sa IATF next week. Kung okay ko sa IATF, baka pwede nang i-implement ito pagkatapos. Nakausap po natin lahat ng schools, sila isusuporta sa kanilang mga estudyante para mapabilis po natin yung pagbakunan. Maraming salamat, Mr. President.
I'd like to ask you your permission to allow me to say something about the procurement of the masks, face shields, and personal protective equipment for healthcare workers. Ako ba, well, I made this guarantee that these transactions are legal, that there is no wrongdoing, there is no crime involved here, that I am willing to resign kung may corruption. Yan ang binigay ko, and I will do it. At kung may makita sila. You know, in March of last year, we imposed strict quarantine protocols and lockdowns in Luzon as part of a response in the COVID-19 pandemic. By first week of April, we have had an increasing number of cases of deaths, which included our health workers and doctors. But then the situation was becoming dire as we also had very limited supplies of personal protective equipment or PPEs in our hospitals. In fact, kulang na kulang supply. Ang capacity natin at that time in dealing with the virus was just almost not really nil, but almost, let me find the inadequate. Well, at the time that no country was really prepared, just like any other in a pandemic, you are racing against time to save lives, quick to decisions and actions, and had to be made to be able to do this. Congress granted executive department special powers under Bayanihan 1. And the exercise of these powers, we procured a total of 288,000 PPEs in April 2020 from China through PSDBM. And were transported to the country via C-130 PAL and Cebu Pacific flights. Alam mo, ako na mismo, sabi ko I have stated for the end time. I was also the one in the hurry. As a matter of fact, the number one person who was really insistent na ngayon, itong ongoing projects ng Congress, sabi ng Commission of Audit, si Michael Aguinaldo himself clarified that the findings of the auditing team that attended the Department of Budget and Management Procurement Service pertain to the inventory management and not to the alleged overpricing of the medical supplies. The auditing that handles PSDB will really pertain more to the inventory management and not overpricing. Michael said during the Senate inquiry, to further accelerate the positioning of the PPEs and critical supplies to strategic areas, BRP Bacolod carrying a total of 200,000 PPEs departed from China on May 1, 2020 bound for Davao City. The PPEs are full piece sets including the now subject face mask and face shields, many of which are allocated for all government hospitals and other hospitals with COVID-19 patients and laboratories. Again, these are meant for healthcare workers and not for the general public. Hindi ito pambigay sa mga in general kung sino-sino lang. As we replenish our stocks of mid-May 2020, we were able to distribute PPEs to a total of 699 hospitals, irrespective of whether government or private hospital. In the meantime, nag-usap kami I had a chance to have a talk here with Senator Soto. Binabanggit kasi niya, sabi niya, I agree that inconvenient masyado ito mask. Is there a way that we can do away with it? Sabi ko, gusto ko. I said, because it is very inconvenient and it really does not make you improper equality, whatever, if there is something hanging in front of your face. Kung sinabi ko, pabor ako, pero nung right after that, as prudence would dictate, I consulted the medical sector, the mga scientists, and they said that totoo, it is not really an answer-all solution, but it can prevent at least with the mask a little of the average protection. And when they mentioned to me the new variant data entering the country, I got scared. So, binalik ko yung there was no order yet, but I never really went to order the doing away with the mask. Ngayon, binalik ko yan. Sabi ko with the coming of COVID, sabi ko, it can add a little more protection. So, mas mabuti na lang na it's a little bit convenience, but it could mean life and death for a person, for a citizen of this country. So, binalik ko. So, ako na yung may order na ibalik, na magsuot talaga. But what was the order of sa DOH nung nag-meeting tayo? Sabi ko, ibalik ko kasi I said, taking the view from the medical people, sabi na, it can increase the average of protection. So, yun lang ang ito naman sabi ni Aguinaldo, dalawa yun eh. Itong Congress, itong maldito talaga to. They started first with, there are two issues. They started with the unspent billions. Tapos sabi na wala namang nakuha, kasi unspent ka, nandyan. But they are asking si Duque kung bakit hanggang ngayon hindi ba nagastos. I mean, you do not run the Department of Health by legislature. Yun ang problema sa kanila. So, wala yun. Hindi ko kasi huwag mong pansinin yan. If you have a program for the remaining amounts in your department, do it. Do not listen to Congress, they're all bullshit. Walang pang lang yan, pang istorbo lang yung yawa na yan. Dito naman sa kabila, dito ko tinaya ang pangalan ko. Kasi tinanong ko talaga yung mga tao. The Commission on Audit, its Chairman Reginaldo himself clarified that the findings of the auditing team that handled the Department of Budget and Management Procurement Service pertain to the inventory management and not to the alleged overpricing of the medical supplies to fight against COVID. Bakit sila maggawa ng inventory na when the program is going on? I think they should let Secretary Duque finish his job, then conduct the inventory of what is left or what is missing, and that is the time that you make, the findings of the auditing that handled PSPM really pertain more to inventory management and not the overpricing. Aguinaldo said during the Senate inquiry on Tuesday. Dito ko nga tinaya. Dito ko sinabi na mag-resign ako kung merong corruption dyan. Ora mismo, bababa ako. Kung sabi na walang anomalya sa disbursement at delivery ng items because it was accounted for, ano ba ang inyong gusto mailisit? Ang agenda ng Blue Ribbon Committee, motu proprio investigations, and the senators keep looking for the technical and financial requirements of Parmali. Wala ka nang pakialam dyan. Parmali is really a Parmali corporation sa Singapore. Doon yun nag-provide. Ito si Michael Yang, whom I knew for the last 20 years na negosyante ng Davao. Siya yung inutusan ko initially noon nung I made contact with the Chinese. Eh siyempre may negosyo, nakikisali, negosyante. Ano ba magawa mo? Na ito ngayon, ang ginaano nila, wala silang makita, yung Parmali. Yung Parmali, what is clear is that there was this contract, there was delivery, kompleto lahat, specifications, basta quality, quantity, and all. Tapos, after delivery, bago pa nagbayad ang Pilipinas. So, ito mga anong gusto na, ito pa rin si Drilon, he might want to explain his relationship with Janet Lim Napoles, since you want to discuss corruption and the use of people's money. And I can still remember that Miss Napoles tampered with billions of pesos. And how did you end up partying in Heritage Park in Taguig with the police and all people? Could you call that a perfect coincidence? You claim that you have only met the police 10 times, but the photos show your closeness. And is it true that the police contributed 5 million to your campaign? At ikaw pa rin ang kasama mo sa Senado ang nagsabi na may binigay ay kapalit. So what did you give in return? Since you have proclaimed yourself and your friends there in the Senate as anti-corruption czar, please enlighten Mr. Senator. Can you explain to the Filipinos your connection with former Mayor Jed Mabilog and General Garbo? And they both connected in the illegal drug trade, yung mga tao ninyo noon sa panahon ninyo. And since we are talking about Iloilo, can you also tell us who owns the biggest mall in Iloilo City and who brokered the sale of the old Iloilo City Airport to make a word. We are just curious, Mr. Senator. Ito naman si Gordon. Itong si Gordon, malalim itong away namin. Talagang mag-aaway kami nitong buhaw na ito. It claims that the Red Cross is totally independent of an adjunct independent from the government, national or local. Tapos sabi niya, because I'm looking for the annual reports in the local sa Red Cross, rating the Red Cross. The Red Cross must submit to the President an annual report. Since then, wala akong natanggap. 6 na taon na ako, Mr. Senator Gordon. Nasaan na ang report? And why would you say now that the government of the Republic of the Philippines cannot conduct an audit sa Red Cross because it is totally independent? If it is totally independent, you are correct. But it is not totally independent because you have been receiving aid, financial aid from the Republic of the Philippines. At ikaga nga, nagkukuha ka pa dyan sa PCSO ng pera. Now, any money belonging to the government of the Republic of the Philippines given to an agency, whatever be the nature, if you're operating here and you receive the money and spend it, you are accountable to the government, and therefore an audit is in order. So in the coming days, I will write you a letter to open up your records, because I will also request Aguinaldo, and I am sure he knows his business, that there is money in Red Cross belonging to the government which he has to look into. Kaya kung ayaw mo, mapipilitan akong totally disassociate with you. I will stop government, the national government and all, from having transaction with you in any manner. Wala akong pakialam, hindi ako magbigay ng pera sa iyo. Saka, as far as I'm concerned, Red Cross does not exist. And you can create a controversy there or a crisis. I do not mind, because I said I am on the right track. Either you submit an auditing procedure or we quarrel. Pag mag-quarrel, do yours because I will do mine. Mahirap yung sabihin mo na at saka Mr. Senator Gordon, kilala mo ba ito si Glenn Tan ng Subic? Do you know him? Because he knows you very well. Well enough to talk about you. Kumusta ito si Gwendolyn Pang? That lady from Sulu na nag-join sa Red Cross. Pakisagot lang nito, no? Para maano tayo. At pwede ka rin magsagot sa akin. Ako pa magbigay ng lista sa iyo. Dito naman sa more on COVID vaccines, we are grateful to the outgoing United States Health Affairs John Law as expressed optimism for stronger security alliance and cooperation between U.S. and the Philippines. On behalf of the grateful nation, maraming salamat. Do I understand that there's a new shipment from Secretary Galvez? Can you elaborate?
Yes, sir. There is a U.S. COVAX donation of more or less 5.5 million, and that's the initial set. Initially, the UNICEF has given us the number of 10, but they just committed 5.5 million for this September, and the others will be following up. And also the U.S. government, through our Secretary of Foreign Affairs, who is already in the U.S., and also Secretary Lorenzana, they have intimated our request for the possible acceleration of the different U.S. brand companies like Moderna and Pfizer. And the CEO of Moderna made a commitment that they will provide 5 million Moderna this coming September, and also Pfizer will also provide another 5 million.
Let me stress the point that we are doing well with our vaccination. But the fact is that there is a shortfall. Hindi natin mabigyan lahat sabay-sabay kasi kulang. I think we are short of about, how many, what it's,
Mr. President, to achieve our goal of vaccinating the 100 million residents of the Philippines by the end of the year, between now and the end of the year, we need a delivery of around 9 million doses a week. That is what we need. A week, 9 million a week, so that we will be able to get a total of 195 million vaccine doses since March. And with all of that, we can vaccinate about 100 million people. So if you divide the balances by the number of weeks, we need around 9 million a week to be delivered by the pharmas. Now, I just want to emphasize, Mr. President, this has already been ordered, and there is already money set aside for this. What we are waiting for is the delivery. Now, as I said, we need 9 million a week. Unfortunately, for the first week of September, we only received about 3.5 million. So we have to catch up for the coming weeks. So again, we want to tell our citizens that as soon as the vaccines arrive, they are actually deployed and people are inoculated. But again, the pharmaceutical companies have had some difficulty in making the deliveries, Mr. President.
Yeah, gusto ko lang ulit, itanungin ko na lang, may pera tayo. Sabi nga ni Secretary Dominguez, we have the money ready. The fact is, we have placed the orders, but kulang talaga worldwide until now. So, nag-aagawan pa rin. Were it not for the good, ng Amerikano pati ang China all contributed the largest portion of our donated vaccines. Mahirapan tayo. Hindi natin sabihin, may naririnig ako, sige, bakit nila bakuna. Gusto namin. And I even suggested to Secretary Garbes to send some to the provinces, especially cities in Visayas and Mindanao, which are hard hit by the pandemic. Kaya itong face shield hindi ko tinanggal. You have to continue using it. Mabutit na lang yan. I mean, a little amount of protection in addition to the mask, which will be provided by the face shield. Mas makatulong ito. Kaysa tanggalin natin and you remove that premium of protection. Not really a complete protection, but the premium that it will provide by wearing the face shields. Yan ang baka ang sinabi nga ni Secretary Dominguez, well, maybe towards the end of the year or maybe early next year, first quarter, we are able to get the vaccines, then we are on our road to recovery. At least by that time, a good number of the people would be vaccinated. Sa Invictin, ivermectin, originally para ito sa baboy. Ngayon, it graduated into a medicine or a chemical that it that provide protection against COVID-19. That is according to some sectors. And marami yan at mga doktor at marami rin yan. And in other countries, they have also embarked on these clinical studies, but the problem is it is not clear. Nobody has published a journal, a medical journal, which the doctors rely on, na magsasabi na all of these tests were conducted and the result is what is being laid down here. Wala pa. Everything is a quandary. Kanya-kanyang pero there is no actual definite finding na publish lang naman baski sa medical journals ng mga doktor na masabi natin na pwede na ito. So, I leave it really to the doctor-patient relationship. If the doctor believes in good faith that it can help, and the patient also believes in his heart that he will get well, we leave it up to you to decide. Kasi mahirap naman masisi na kung totoo talagang effective tapos pipigilan mo with the testimony bound plus yung mga maraming tao nagsabi na gumaling sila. So, for some people, it would be quite a good gamble to embark on. Pero ako, I am guided, since I am with government, I am a worker of government, I rely on the work and the narratives of government doctors. So, I am bound by what they say. Hindi masyado ako pwedeng magsalita ditong ivermectin. My suggestion is doctor-patient na lang. If both doctor and patient believe that it can help, that it will produce result, then sa inyo na ho yan. I leave it up to your good, ano ninyo, kung discernment, kung tama ba. On the granular lockdown on GCQ with alert levels, last September 8, the Interagency Task Force for the Management and Emerging Infectious Diseases. In fact, ito na nung sa resulta nito. Yung bunga nga mo, hindi masyado bumuka. Emerging infectious diseases has deferred the implementation of general community quarantine with alert level system in the National Capital Region. Ako yung isa nagsabi yan, kulang ang guidelines. This to further refine the guidelines, ayan. I ask for the general public's continued understanding and patience on this matter. I know that many of you are raring to go to work and conduct your business already, but we have to make sure that we cover any contingency so that we may reduce the risk of infections. Frankly, I'd like to be honest with you. Kung ito lang, it does not involve death or serious physical illness. Kung pagka ito lang, it's a matter of being a cough syrup or a pill for a headache, a migraine maybe, hindi na ako mag-alam nito, hindi na ako magsalita. But the problem is, buhay, yan ang mahirap. And I would not want to be remembered as one who caused the death of so many. Kung maaari lang, minus-minisan ko yung mamatay dito sa Pilipinas during my watch. Walang ganun pa rin. Mask, hugas, iwas, bakuna. May tama yung iba na we are pushing people really to go and get the bakuna, but in some places in the Philippines or a large portion of the country nasa tabi bakuna kasi kulang nga. Inuuna natin yung population density. Kasi kung mas maraming tao, mas dikit-dikit, mas marami ang hawaan. Ngayon, sa baryo, tag-1 kilometro kalayo yung bahay ninyo, and if you follow government admonitions, mas maganda. Kaya yung inuna natin, yung mga Cebu, Cagayan, Davao, maybe Bacolod, Bataas, Manila. At itong Manila talaga ang pinaka. Itong Luzon. May ibang lugar. Davao, marami rin tao. Density ng tao ang problema eh. Yung malapitan. So, whether you like it or